So let's start with it. In some ways, Director Walensky's statement and email was sort of a bit of like, okay, that's exactly what you would expect, you would hope an after-action report of sorts would indicate. Based on what you've read of the email and what she's talking about, is she on the right track?
I think she is. I think the CDC director was pretty unflinching in her analysis of what the systemic problems have been at CDC, not just in the setting of the COVID outbreak, COVID pandemic, and the monkeypox outbreak, but going back to Ebola and Zika, even seasonal flu, where the agency has suffered systemic problems, trying to gather data, make it available to the public, speak directly to the public, put out guidance that's actionable, that's bottom line, that businesses and consumers can interpret. The agency's long suffered from the fact that it has a very academic culture. They are accustomed to trying to collect information, put out analysis and published articles, and not speak directly to consumers in actionable ways. And I think she was pretty unflinching in her analysis of that, and is on a path to trying to put in place some reforms that will start to address it.
It's always odd to me, Dr. Gottlieb, that the CDC director was never the one front and center at the beginning of this pandemic, and whether it was the current CDC director or the previous one, that it was coming from NIH. You bring up the academic. Shouldn't NIH be the sort of more academic environment and CDC be the more public health emergency agency? No?
Yeah, look, parts of CDC are action-oriented. They're operationally driven. But by and large, that organization has a very academic culture where they're accustomed to collecting information and doing very long-dated analytical work and not putting out real-time information that can inform current decisions and inform policymakers. The decision in terms of whether or not the CDC is speaking to these issues on a daily basis or someone else in the administration was doing that, that's ultimately a decision made by the White House. If you remember, during the Ebola outbreak, the Obama administration had Besser, the CDC director, really run point on that and be the spokesperson. During the Trump administration, the CDC director didn't speak to the COVID epidemic. And in this administration, they've had other people running point for them in terms of the communication. That's really a decision by the White House.
Is there any of this in what she announced at CDC that her hands are going to be tied a little bit because of HHS?
Well, ultimately, she's going to need support of HHS, but I think the real challenge is going to be that in order to fundamentally reform that organization, you're going to need help from Congress. Ultimately, with certain aspects of what they do when it comes to their core disease control mission and really their national security mission, they need new authorities and new resources. I think in terms of getting a bargain from Congress, what they ought to be thinking about is trying to narrow the scope of the CDC's mission, trying to give to sister agencies components of what CDC currently does that other agencies may be able to do just as well, if not better. For example, post-market vaccine adverse event reporting. Some of the tobacco work can both be handled by FDA. Some of the disease prevention research can be handled by NIH. And then go to Congress and say, look, we want to focus on the disease control mission, but to do that well, we're going to need some new resources and new authorities. I think the only way that CDC is going to get those new resources and authorities from Congress is in some kind of bargain like that, where they more tightly focus the mission of that organization.
Is the current monkeypox outbreak sort of another exhibit to say, hey, this is how, boy, we were a little slow here, and yeah, this is another example of CDC being a little bit on their back foot?
Well, CDC and HHS, I think we've suffered from the fact that we've done things very sequentially in the setting of this outbreak rather than in parallel. For example, the issues around the vaccine supply. They could have made some decisions early on to start finishing some of that vaccine. They had 11.5 million doses in frozen bulk product that they could have started finishing right away while they worked with the manufacturer to scale up manufacturing of new stock. Those things were done very sequentially, and so we didn't have enough supply early in the setting of the outbreak really to address the public health challenge. So I think it's some of the same mistakes that are being made over again, but these really go back a decade. I think the agency's been operating this way for a very long time.
Let me ask you on COVID, should we take any positive feelings away, the fact that there hasn't been a new variant pop up in a while?
Well, I think it's too early to really draw conclusions, but there is a presumption that at some point the future mutations are going to continue to happen within one lineage, and it may be the fact that this Omicron lineage is the dominant lineage now, and then future mutations that do occur are going to continue to happen within this lineage. And if that's the case, then a lot of the immunity that we've built up from past variants of Omicron should provide sufficient cross-immunity that you won't see this spread as aggressively as you've seen with these new variants when they've emerged. So I think that you could take some comfort in that fact that we haven't seen a new variant emerge, although it's still early. These new variants seem to emerge on a sort of a 2 to 3 month timeline, so we're probably due for one within the next month if it's going to emerge.
And I hope my question didn't just jinx us there, right? It's like watching a football game and the announcer says the field goal kicker hasn't missed one in so long. Very quickly on polio, this finding in the wastewater, this should be containable. How concerned are you, though, with vaccine hesitancy that if we do try to get some folks revaccinated here, we may have a problem?
Well, it should be containable, but if you look at that county where it seems to be spreading, I think at this point there is community transmission. That seems to be the message coming out of the CDC and public health officials in New York. That community only has Rockland County only has about a 60% vaccination rate, and some parts of that county are as low as 37%. So we're going to have to do a lot better than that if we're going to control the spread of this. And vaccination rates have fallen all across the country. I think a lot of the criticism of COVID vaccinations spilled over into people's willingness to take other vaccines.
Yeah, hopefully it doesn't cause other nearly eradicated diseases to start popping up as well. Dr. Scott Gottlieb, good to have you on. Thanks for sharing your perspective with us.
Thanks a lot.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.